Hello. Good morning. So nice to see you all again. My name is Ana Garcés. I'm from Guatemala, and I work at the Central American Nutrition Institute. And I have the host of being the chair for this last session, which is about public health emergencies. So just to give a little context, public health emergencies of international concern were defined in the International Health Regulations in 2005 for the very first time as extraordinary event, which is determined as provided in these regulations. And I think that the way that these are defined is really interesting because of the implications that the public health emergencies of international concern have. The first definition is that they constitute a public health risk to other states through international spread. And the second condition that they may meet is that they potentially require a coordinated international response. So under that definition, these are all determined by the Director General of the WHO, and there have been 4 public health emergencies of international concern determined so far. The first one was in 2009 for swine flu. The next one was in 2014 for an outbreak of polio. The third one, which is something we're going to talk about today, was in 2014 for Ebola. And now the very last one, which we're all very familiar with, was in February of this year for Zika. This is obviously very concerning to all of us that are from Latin American countries, especially as we begin to see that these babies are being born, some with microcephaly, some with other problems that we don't really know yet what exactly these are. And I think that it poses an additional problem that the region of the world where these problems, where Zika is happening, is also the region of the world that has a lot of reproductive and health issues, challenges, in the sense that there's a very strong religious presence. And a lot of times in these different regions and in these different countries, even birth control is still controversial, the use of birth control. So it's ironic that this epidemic is happening in a region where all of these problems are, and that obviously is going to have such a big impact on mothers, on babies, and on their families. However, in general, for all public health emergencies of international concern, I think it's safe to say that these pose unique challenges specifically for facing them, but also for doing research within them. Some of these challenges are related to the time frame because they are so urgent and they require a very rapid response, as we can see for Zika, for example. The first cases came out not much more than a year ago, and now 1 year later, we're seeing such a big impact all around Latin America. They also pose unique challenges because often the populations that are affected are already very, I want to avoid saying the word vulnerable, but they're populations that have a lot of poverty, they're populations that don't have access to health services, they're populations that don't have access to education. So this makes them even more challenging. And obviously in these areas, often the healthcare systems are very weak and not a large segment of the population has access to very good healthcare services. So within this setting, we're going to talk about 3 topics for this session. The first one is an introduction about how the WHO handles these challenges, how they specifically address the public health emergencies of international concern. The second one is going to be related to Zika outbreak and the development of a vaccine to address it, which is obviously something that we need very urgently in order to stop this epidemic. And then the third one is going to be to talk about Ebola and the access of pregnant women to the experimental drugs, which is also a very important topic that needs to be addressed and that I think we all need to talk about. So our first speaker, who I am going to ask to come forward, is Melba Gomez. She's a scientist with 25 years experience in malaria. She has worked at the WHO, and she is currently chairs the WHO Ethics Review Committee. Thank you.